Welcome to our May session. It's with Patty Douglas, who is an associate professor and the inaugural chair in student success and wellness, as well as director of the Center for Community Engagement and Social Change in the Faculty of Education at Queen's. So it's been about 2 years now. Is it three?
3 years. Yeah, 3 years in those roles. Yeah. I feel like I need to wear like three hats on my head. Many hats.
So, and it's neat because you do really interesting work, I guess, focused both on folks with disabilities, but also thinking about families and the family perspective, which is a nice
Yeah.
blend for us because we also try to work in that space, thinking about both those things, and also recognizing, of course, that you can be disabled and also be caregiving. That we're all
Absolutely.
loving and caregiving for people in our lives, so not so much
Yeah.
a dichotomy either. Anyways, the time is yours. After you're finished talking, we're going to have a nice informal discussion. And some people may use the chat box and some people may raise their hands, but I don't want to take too much more of your time blabbing. So I'm going to be quiet and turn things over to you.
So I'm going to be talking to you about a project called Tired of Spinning Plates, which actually took place in England. And there's a group of us, including some of the folks here, who are working hard to bring this project to Canada. Um, So I wanted to share a little bit about that with you, and I'll just introduce myself sort of again and tell you broadly a little bit about who I am. So I am an associate professor in those other roles. I'm also a mom, and I have two sons, one of whom is autistic. And I used to be a special education teacher. And really, through all of those experiences, as well as my own experiences of neurodivergence, I came to a place where I wanted to influence schools and services more broadly. And so, like anyone else in probably in the room, like many people, we get involved. And so I decided to do my PhD. And one of the best decisions I've ever made in terms of being able to do this incredible work. And so my kind of flagship project is called Restoring Autism. And I started it 10 years ago. And really, it's an interviewing and storytelling project where we elevate the voices of autistic and neurodivergent folks, as well as families and professionals of all kinds to, number one, bring those groups together, which I think needs to happen more if we're going to meaningfully change things. And secondly, really to elevate stories that haven't been told enough. So, especially around, self advocates. And this has led me to all sorts of places. So, England, where I'm going to be sharing a project called Tired of Spinning Plates, where we did this storytelling, but also Vietnam more recently, India, New Zealand, all sorts of places where we are elevating these stories. And I think to change systems, we need both sort of numbers, but we also need the stories that go with the numbers. And so that's sort of my specialty, is around the stories that go with the numbers. So I'm going to be giving you a little snapshot of the Tired of Spinning Plates project, and then I'm going to share three short films from that project, and then I'm really looking forward to talking with you. So the Tired of Spinning Plates project is led by Catherine Renswick-Cole and Sarah Ryan in the UK. And I was the lead on the storytelling sort of thread of this project. And we were interested in it sort of addressing the question of mental health and family caregiving. We focused on adults with learning disabilities, so family carers of adults with learning disabilities, which in Canada, we call that. So we looked at participants' perceptions of their mental health and their views on the accessibility and quality of support. And this sort of synopsis comes out of our final report, which you can see there, which you can find online. And I'll share the website with all of the different outputs and resources from the report after I'm done. Um, So, and the artwork that you're seeing is actually from our online exhibition. So we did public involvement, which involved something called the Tea and Cake Group, which was mostly self-advocates, but also caregivers who helped to lead the research. We looked at the literature on mental health and caregiving. We planned a survey, but from the feedback we got from the T&K group, they said they were tired of surveys and wanted to do something more meaningful. And so we flipped and did an online exhibition. And you can see a piece of needlework that was submitted to that. So it says, this is fine, but if you look more closely, you can see this is not fine. There's some other words in there also. Um, we did interviews with parents and sibling caregivers, and we did digital storytelling workshops with parent and sibling caregivers. So, two different workshops. And then we moved it out into the world in various ways, and we created sort of learning and teaching materials, which you can find on the website. So, just some of the highlights of this project, we found that the love that we bring as caregivers is often kind of exploited by health and social care services, which are not in England anyways. And we find so many resonances between our contexts, which are not kind of giving the basic support information and acts of kindness that make such a difference in our lives as caregivers. There's an enduring struggle for support, and there's worries about the future. And those were often identified as the cause of mental distress, not the young or the adult that was being cared for. Participants know what supports in mental well-being, sort of what supports mental well-being, but don't have a lot of time to look after themselves because of a lack of support. Social services were often described by these caregivers as hostile or absent, and participants really viewed themselves as exhausted by the lack of support rather than depressed. So there's a lot in the literature that says depression and caregiving are sort of go together, which they can sometimes, but the way participants understood that was as a lack of support. Medication was often offered, but their caring roles were not considered in that medication conversation. And participants often asked for support to be met with kindness. So, kindness made a huge difference in this system that isn't supporting enough. So, what I have brought today are three films that we made on this project. One is from a caregiver, a parent caregiver, one is from a sibling caregiver, and one is from a self advocate. The running time for these is about 8 minutes or so. So, sit back and have a snack. I always say I forget to tell people to bring their popcorn for these viewings, but um, we have developed some questions that we often ask people to hold and consider when they are viewing these videos. So the point is not to sort of master something or teach something, but really it's witnessing a story, and we are kind of holding space to ask, what is the storyteller asking us to see, hear, feel, or sense that might be new? So other questions we often ask are, how does the film touch or move us? So we do go into the realm of affect or emotion in our research, which is also a distinguishing feature sometimes in the world of science. But it is incredible the way that we've taken these films to multiple audiences around the world, and the way in which transformation happens in thinking because you can speak to people's hearts. And so that kind of kindness that participants identified really is enabled by this kind of product in research. And really interesting things happen afterwards when we follow how people have been changed by being part of these workshops, or by being part of a viewing of these films. So I'll just say that. Are there any questions before I share? Okay, terrific. So if you have trouble hearing, one of the first things you can try if you have trouble with the sound is turning up your own audio. If that doesn't work, somebody please shout at me because all I see are my slides. So we've got one film from a caregiver, one film from a parent caregiver, sibling caregiver, and then a self-advocate. And then I'm gonna stop and we'll have our conversation then, and then I've got a couple of slides to wrap up with.
I know what will happen today, but we start our walk anyway to get coffee in town. People who know us say, "Hello, are you going for coffee?" "Yes," I reply, "we're going for coffee." It's a standing joke, as we go so often at weekends and in the holidays. As we walk into town, passing families, children of all ages stop and stare, open-mouthed. My daughter doesn't see it, but I do. I see it every time. They crane their necks as they carry on walking, trying to work out what they see. What they see is an adult human being, just different. I can see they are trying to work out, why is that person walking with their head down? Why are they walking so slowly? Why have they got their arms linked? What's wrong with her? What I see is my 20-year-old daughter, a beautiful human being, just like them, but different. If they ask their parents, they are just pulled along or shushed. I always smile at them because I know they don't understand that she's disabled. They don't even know what that means. It's just about acceptance and being kind. I could say to them, my daughter was born with an extremely rare chromosome condition, meaning she is severely mentally delayed, physically delayed, and non-verbal. She needs one-to-one support every day and has no understanding of the real world. How can they possibly understand what that means? It's okay to look, not stare. Acknowledge the difference. Accept what you see is okay, and smile. Schools and parents, please educate from an early age so children grow up accepting that it's okay to be different. And teachers appreciate not everyone fits into one box. Don't exclude, include. Often children with disabilities are living in a world that they have to conform to. It is not their world. If you can be accepting of a character in a film, on TV, or in a book, then don't be frightened, feel sorry, or ignore someone with a disability. Smile and say hello. Get to know that person. You might learn a lot. I know what will happen today, but we start our walk anyway to get coffee in town. My daughter doesn't see it, but I do. I see it every time.
I think of the future every day. Actually, more than that, multiple times a day. I worry and I overthink, and ultimately I end up going over and over what the future looks like, not only for my brother, but my family as his support network. Nobody else will ever be an expert in him like we are. We are the 4 people in his life who know the very ins and outs of him as a person, like his triggers, fears, behaviours and actions. It's hard to think of him being cared for in a different setting other than our family home. It's all I've ever known and my family have known, and I worry that no care provider will ever know him truly. I want him to live a full life, but I don't know how he will do that safely in the future. The thing is, I want my parents to have their lives back too. And the only way that that is possible is by letting go of my brother and allowing him to be looked after by local services. I think the future will always be uncertain. As much as I try to plan and structure things, it's very much out of my control. I worry about my parents getting older and the responsibility of my brother being down to one parent and my sister and I, or eventually just my sister and I. To be wholly responsible for someone as a person and take ownership of such big things like their health, finances, well-being, and quality of life is a very scary concept. I think of the
I am very proud of my job and want to be seen as professional, punctual and reliable. I proudly put on my uniform and prepare to set out for my shift at work. But the clock ticks by and you are nowhere to be seen. As my personal assistant, you are supposed to be here with me to go with me to work and support me while I am there, but you aren't here. I feel anxious and worried as the clock continues to tick. An hour has gone by and now I am late for work. This happens far too often and I worry about what my manager thinks of me. Do they think I'm unreliable, unprofessional, lacking work ethic? I know these words do not apply to me, but that your actions may make others think them of me, and that is unfair. Once at work, your lack of respect for my work continues. You spend my shift taking personal phone calls and even wandering off to do your own shopping, leaving me unable to find you or benefit from your support. Don't you see that your actions have an impact on me? You are supposed to be supporting me, but you are simply embarrassing me. Your life seems to take priority over mine and I feel belittled. Like when you told me you were no longer available on Tuesdays and I would have to work on the weekend instead, even though I'm supposed to have weekends off to rest and wind down a busy week, but you don't see that as a priority, even if my manager agrees weekends may be too busy and overwhelming for me. When you announced you were going away for a surprise holiday the next day and I would have a stranger as my PA for the next 2 weeks. A stranger who had no preparation about how to support me and on one occasion forgot to give her child their book bag for school and took me all the way to her home to take it to their school before taking me to work. This made me 45 minutes late for work, making me feel uncomfortable and uneasy. And the times you decide we need to leave an hour early because you had other plans. No, we need to go now. My job was left unfinished and I left feeling embarrassed. You make me feel like my job isn't important, but it is very important to me.
So I'll just bring us back to this. Someone just commented, these are heavy videos. They are. I probably should have said that at the beginning. So my apologies for that oversight. They are they end up being really, really authentic to what is happening in a person's life at the time. And so the question we ask of people is, what is the story that you most need and want to tell at this moment around this topic? And some of the things that we think about are questions like this. What are these storytellers asking us to see, to feel, to sense? How do the films touch or move you? And how do we take these films to the audiences who most need to see them? And we spend a lot of time thinking about all of those questions, sort of methodologically, as well as sort of pragmatically. How do we intervene in systems? You know, you can bring the numbers, but you also need to bring the stories. So I've seen all sorts of things. I'll just stop sharing there for a minute. We've brought this widely to many different audiences. So I guess I would love to pause here and just see if there, impressions. I'm gonna take myself out of the spotlight if that's okay with folks. Any questions, any thoughts, any feelings that covered a broad range of questions, of issues, of stories, of experiences, of perspectives. I'd love to hear your thoughts, your responses. And it can be a lot sometimes, I realize, taking all of those in. Someone in the chat has said these really speak to the truth. I don't know if you want to say more about that, Sue?
Sure. Can you hear me okay?
Yes.
Yeah, really, really very powerful. And it's interesting. The music always grabs my heart too. So the music adds to the emotional tone. Um, and you know, as a caregiver myself, I see you're hitting all the key themes that caregivers live with. And I guess one of the things for me is whenever some material kind of opens up and opens that box, which holds all of that uncertainty and all of the system gaps, all of the massive puzzle pieces that caregivers spend their lives feeling anxious about. Nice to then provide a space to take that opening up and channel that into action and channel that a little bit into uh, what are the next steps? What are we doing? So now, okay, so we just got you to feel all the pain. Now, what do we do about it? So kind of nice to close off on a I guess on an action note. Yeah. Yeah, but they're
Absolutely.
yeah,
Yeah.
you certainly you nailed the power with it. You nailed the key issues. Yeah. Yeah, very very
Or the storytellers did anyways.
yeah, well, yeah,
Like,
yeah,
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 yeah, we just open space. Like, these are their
yeah,
stories
yeah,
for sure. They're not directed by us. Like, each
yeah.
storyteller directs and composes their own story with support, of course. But like this, so this is what's called sorry, I think my asthma is acting up. A participatory action research project. So this part is the participatory part. We're guided by the stakeholder or interest holder group. We hold space and support folks to tell and make the stories they most want to. And then we bring them to audiences that were sort of directed by the participants of the research project as to where those videos should go. And then we ask people, is it okay if we bring them to these different audiences? So, you know, across all of the storytelling projects I do, which this is one of them, um, I've taken them to policymakers. We've come up with action plans. I've taken them to educators. I've turned it into knowledge mobilization events where then we have educators and practitioners and service providers from the community. So we do something called NeuroVibes now that started out of the storytelling workshops. So we always have that piece. And on this project, we really were thinking about medical doctors as well as social workers as really key audiences in the system that that compassion and acts of kindness goes such a long way. And education around, like, this is a form of kind of education, these videos, when you bring it framed within, a social model of disability, which says it is almost always the system, not the person. Like, people, we struggle, all of us struggle, all of us need supports, but the key sort of thing that's missing is the system response. So, and even if you are struggling, like, that's okay. We all struggle, we all need support. So, that first video when she says it's okay to be different, that really strikes me. So yeah, I really appreciate your comments too. Like, and I'd love to hear ideas of where these videos should go. Hopefully, eventually we'll get the funding to bring this project here. We've tried a couple times. I'm gonna try one more time because it's a really important project, and it humanizes healthcare, it humanizes services, and it opens space for action in research, which is directed from the people who are living the stories that the services and systems serve. Yeah, yeah. Anyone else want to add onto Sue? Yona?
So I've seen the videos before.
Oh, okay.
I think there was a UK presentation that was a webinar. Doesn't matter. I imagine you feel this too, Patty, that every time you hear somebody's words, you like pick something else up, or you know, like I feel like I should connect in some ways the most to the sibling video because I'm a sibling, but you could connect to each of those three voices. Do you know what I mean? And I think the stare one really, I think, because anyone who I think is different or loves someone who's different kind of knows kind of about the stare. And it's just so what I liked that it was offering also a suggestion of what to do. It was very specific, right? It was like, teach your kids when they're young, like it's okay to look, but that's different than staring. And you can ask
Yeah.
questions. It's okay to ask questions. Like, don't be afraid, and allow difference in your life. And like, I just thought it was so, and the way the mom chose to sign what she was doing as well as speaking it, I thought also was really important.
Mm.
And the pictures of her daughter were beautiful. Like, I don't know. So that for some reason the stare and just that like it just triggered something very deep in me, I think, thinking about just that experience, I think, of having people stare.
Yeah,
So I thought that
I
was
do.
well, but all three of them, like it's not even like which one was most powerful. I think it's more that I feel like there's certain ones I should connect with, but I ended up feeling some connection to each one. And even the third one, right? Like I have to leave now. Why? Like this is. And even hearing like he didn't try to perfect his voice so that he got each word exactly right. Like if he needed to kind of trip over his words or say it again, like that's just him. Like I felt like I was hearing. I'm assuming it's his voice as opposed to someone else's, but it just felt like there was a person there really trying to express how stressful it actually is, the clock, right? Like when this is happening and what that might mean. Like I feel like seeing that for employers to see that when they're
Yeah.
supporting someone with a disability, and not having the full picture. It's a very effective way of helping people appreciate things that you can't explain with slides, right? Like these are the issues that people experience, blah, 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 like taking a few minutes when you're giving any kind of talk and knowing, well, here's the story that's going to help situate that experience or that thing to think about. And then maybe the last
Yeah.
comment I want to make is just the idea that the family said no more surveys.
Mhm.
And how sometimes we really have to listen to that because we all do a lot of surveys here. And that there's actually, at the end of the day, with all these projects, when you have a powerful story that's told in a visual way and in a way that people can relate to, it actually goes much further than, survey results, right? So, and that you had to just be able to switch, like that wasn't in your plan to do it quite like
Nope.
that, right? So, but that's important. I was just reading something today about what really is co-production versus consultation. And if you're not willing to switch your plan after you hear that, it's not really co-product. Like, like you have to be able to just change things. And we have to think about, Yanni's doing a project that's, including an exhibition. And I think this idea of different ways we can share people's experiences is so important. So, but I'll stop talking.
Oh, thanks, Yana. I can hear, like, I so relate to all the stories as well. But for me, it's the sibling story, because as a parent, those are stories that are like, they're so close and tight, and you don't often get to hear those stories. So for me, the first time I saw that, I was like, oh God. Yeah. Yeah. But yeah, I do get something different every time from them. And I think employers is a great idea, like, to bring it alive. Yeah. Thank you. Thank you so much. Yeah. Yanni.
Hi, thank you. Thank you so much for sharing the films. I always, yes, as everyone, get an emotional reaction. And I love how you introduced the idea that affect, it's about affect, and that's information as well versus numbers. And we need that affect. And I sort of lost my train of thought because I was listening so much to what Yona was saying and threading it together. But I think employers, but as you know, I think also, because you mentioned this was to target maybe social workers and people in medicine or physicians. I'm wondering whether you mean people who are currently working, but also when they're in training early on, is an important piece. And as you know, we've done a little mini project with the OT students in the first year, and we developed some stories with some storytellers about healthcare experiences. And I would have to say, as sort of Yona was saying, I think that has just so much more weight, value, and sinks in and is internalized more versus me giving a bunch of slides about, you should worry about caregivers, you should think about siblings, and so that they kind of are taking in that emotional information and then reflecting on how that might look in practice. And I think one thing I'm interested in is then how do we just like you learn anything when you're in a program, bring this affect information into informing and reflecting on your future practice and practice as well. And sometimes students in training, well, I find that as an educator, are so keen, just tell me, they want the hard skills, you know what I mean? Like, how do I do this? How do I do a wheelchair assessment? How do I do this? And when you introduce these types of things, they think them as soft skills. Yeah, I know how to do that. Oh yeah, that's important. And they always think it's important, but then they're still so get stuck on they need these hard skills, whereas the relationship and the affect was actually just important than what you do with that information. And so I think it's coming up with ways to infuse this and integrate in the education of future. So, was that a video? Service providers. Sorry, we just had someone come and say a big hello to us. I don't know if you heard. So we were just giggling. So anyway, I just want to say that is like this continual reflection or critical reflexivity within the training and education of people in teachers, like healthcare providers, service providers, etc. So it's not just, oh, this is something, plus all these hard skills you've learned. This should be read throughout. And now you have to think about this. It should be thought about all the way through.
Yeah, I mean, I agree so much, Yanni, and in my own sort of broader work, the training piece is really something that I focus in on. I do find the same thing, like teachers in training want a checklist of things to do, like just tell me what to do for this kind of student. And that's that kind of, recipe, like here's what you do and it will be accessible. No, that doesn't work. So I often work with in-service teachers where they've had a little bit of experience in the field, and you can bring them back and they know that what they've been told by those checklists actually doesn't work, and it doesn't feel good for anyone. So I'm really, really interested in that space in particular, because, you know, not to say you shouldn't do it in pre-service or in train, like, you know, with students. Absolutely. I absolutely do that too. But that space where they've had a little bit of experience in the field, I find is a really generative one, because they bring enough confidence, experience, knowledge, like sort of practice knowledge with them then, and are open to these conversations, and being confident enough or having enough skills and practice knowledge to actually make those changes. And then the other thing I think about a lot are things like communities of practice, or research practice partnerships, like something that would allow practitioners to continue to come together, because we are still in systems that don't actually, like there's a misfit between where systems are currently at, the systems we've inherited, and what we hope and know to do. So yeah, so I think a lot about those things as well. Yeah.
And I think, like, finish with, I think one thing as health or educators is to remember that we're also socializing people into a profession. So
Yeah.
part of that is professionalism, but also we're socializing people into a profession, and what values and beliefs we hold as professionals all the way through, like being socialized into that, or grounding person and families, etc. Anyway, I'll leave it there. Thank you so much.
Absolutely. Thank you, Yanni. Does anybody else have any thoughts? I saw Janine is here, sibling of someone with a developmental disability and practicing social worker. Janine.
Yeah, actually the second video definitely, they all resonated with me, but that one in particular, when they talk about how we are the experts. And so part of my role actually in social work is to help with transitions from hospital into supportive living environments. And I think that point there is very important for developmental support workers to keep in mind, or even clinicians who are supporting those transitions, because like, as much as we may have education or training within the field, we don't know that person as much as the family does. And I think it's really important to keep that in perspective and let them and the person really guide that. And I know just keeping in mind how difficult of a decision it can be to do that, and how overwhelming and scary it can be for a family. I think that's something that, again, as a social worker, I often end up supporting those big emotions that come with that decision, and the days even leading after the transition, how hard that is. So yeah, that would be my takeaway, I would say.
Yeah, thank you so much, Janine. I often think about, I think about moments like when I got my son's diagnosis, like these pivotal kind of moments, and what kind of information is available to individuals and families. So what you're talking about, like, there's a whole bank of stories that I'll share access to, both my sort of larger umbrella of projects across all sorts of contexts, but this project as well. And I often think, if there was, that's why we were thinking medical doctors, social workers, like if there's other information that's available in those moments that could be passed along, so that, because often what happens is, unless someone is really attuned like yourself, there can be a kind of disconnect where then families and individuals get all of this not so helpful information often. Maybe some pragmatically helpful, but on an emotional lived kind of level can be, feel jarring or disconcerting. So those are really important moments in which, stories of, like, another project I'm doing right now are stories of thriving of autistic youth, like just ways to look at this differently in systems. Yeah. Yeah. Lovely. Yanni, did you have another comment or yeah?
I promise Kendra this time,
No,
not me.
please.
Okay.
I always love your comments. Hi, Kendra.
Yeah. Thank you so much for this. If a picture is worth 1,000 words, the videos are worth like 1,000 emotions, I think. And like Yona, the mom's story really struck me in a lot of ways. And I was positioning myself as a new parent and thinking, wow, I have this incredible responsibility, but also an opportunity to teach acceptance and to model acceptance. But then Yanni's comment about socialization, there was something in that video too where the mom said, children are looking, but they're not necessarily staring. So it's like society kind of ascribes that value or not. And I think that there's a great opportunity for early child care educators or early parents to sort of get exposed to some of these things so that they can reflect on that in their own parenting or their own early child care modeling and supporting. So yeah, that was just something to thank you.
Yeah. I know I often think like I'm a bit of a philosophically informed sociology of education researcher really at the end of the day. And I often think, why are we so afraid of difference? Like we've had to value it higher and lower. We stigmatize people who are different, like as humans. So that comment just brought to mind that and the opportunities there are around teaching, like not reteaching or re-educating children out of their natural curiosity and acceptance that, we often see. So yeah, thanks, Kendra. Yeah. Anyone else? Yeah, Lee.
Yeah, I'm a little bit gobsmacked with the amount of emotion those three stories elicited. I think about my own son, who was I think a bit of a courageous trailblazer, who was the first autistic child any of his teachers taught in class, and he's only 34. And we had done all of this advocacy for him to be in a regular classroom to inform his classmates about difference, and yet here we are at 34, not even having a job. The third video, or and the fears of the sibling expressed in the second video, that both my daughter holds, but also we continue to hold as parents. So it's a bit of a trifecta of emotion for me, because I relate to the suffering in all three, the lack of options for the future that we all of us here on the screen recognize, the idea that to show acceptance. It's, you said, you really prefaced your talk with kindness being such an important theme, but kindness isn't enough, right, Patty?
Yeah,
Kindness
of course.
isn't enough. We need to move beyond the loneliness of holding these three things for so long. We leave the education system, and even though my son and his colleagues were like this cohort that went through and said, let's do things differently education-wise, they're still not the kids that are invited to birthday parties, and they're still not the kids that are now adults and are invited out to movies. And this continues to be this loneliness that they experience. And I feel like, although that young man's points were really, really valid, I think even if you have another video just talking about the loneliness from an adult perspective. Anyway, I'm going all over the place because they're very powerfully done. But yeah, I think that I can understand why people would watch those and just say to themselves, but what do I do? What do I
Yeah.
do with this information? And I think if there's, it's understandable that people want to do something after watching them, but what do I do? And just being kind isn't enough,
No,
right? And not saying you
absolutely.
said that, Patty, but
Yeah.
I'm kind of had it with people just saying, "Man, that must be so hard," and you're so brave, and you've worked so hard. I'm kind of done with that. Like, actually, help me now.
Yeah.
And there's people like Fiona and her team that are very dedicated to doing that. But man, it's slow.
Yeah. It's so slow. And Lee, thank you so much for I feel all of that. I still have moments I fall down and just sob because it is so hard to live in these systems. And you're right, like kindness is not enough. And even in a participatory action research project like this, you get to the action part, and the systems are hard to move. It's hard to reach those people that you feel might be able to make changes. Um, you know, people, it does live on in people's lives from the research we've done on the effects of this kind of research. Both the participants in the workshops, they often make connections with one another. All sorts of things happen. They build skills. They form groups that live on after the research is over. And you know what you're talking about too is like we found this sort of fierce love, like a kind of anger that moves you to movement, and incredible advocates in the system. But we need each other, you know, is what I also hear you saying, and our kids need each other too. So there are no easy solutions. There really, really aren't. And, you know, I often, in my experience of doing this kind of work and being involved, like from when I started as a parent and a teacher, um, the words have changed. Like we use words like affirming now. We use, you know, the discourse, the conversations have changed. But I do think the systems are hard to move, and so we have to come together. Like that's sort of where we always end up on the projects is how do we stay connected with each other so that we can both survive and thrive and continue to advocate in systems and rest when we need to. So yeah, it's not easy. And I know in, you know, all the research I do, people who take part do say sometimes kindness makes all the difference for me to get through my day, but it doesn't change the system, like you're saying. Yeah. I wish I had like, here are the 5 things we can do. You know, we're working on it, all of us in lots of different ways, I think. Yeah. Thank you, Lee. I feel that. Sue.
Just to, and because I know that we're probably getting to time here, but just to kind of emphasize that the fact that Lee can articulate over the decades, right, Lee? Like as you said, like you were trailblazing and you were changing systems when your son was young. Well, you were working on it. I know, I see, but you were working on it way back when. And here we are all these years later, and you have been, pardon my French, but busting ass to make change for all these years, telling your story, fighting, bringing that voice, right? And here we still are. And you're saying, what next? So I just want to say, Patty, clearly you have made some of the most powerful videos that are out there on this, because I think all of us kind of were commenting on the emotional power that you've been able to capture in those. So kudos to you. You harnessed that. And I think now the next step with after now that you've harnessed the key point of accessing the emotions. And now, as we know, once you activate the emotions, you have to move it. Otherwise, you turn people back, and it makes things more difficult. So now that you've harnessed it, I think that now the next step is beefing up, or tofu and gingering or whatever up the like you said, the 5 things. What are those 5 things going to be? How is that going to be? Like you said, we all need each other. Like Lee said, Yona is kind of the hub in the center of the wheel here anyway. But I think you've got very, very powerful stuff, and now we got to do something with it, because you're this is the call to action. Like you've got the call there. Now what? But
Yeah.
I agree, we got to do something else, because it opens up a lot without those next steps.
Absolutely. And, you know, on each project, the now what is a little bit different because it's participant driven. So I cannot tell you how many professional development trainings and advocacy with policy make, like, that my list is endless. So and now this major sort of event in southwestern Ontario, but it doesn't feel like enough still. So I'm thinking about a training institute now. Like it's, you know, I feel at capacity with the amount that I'm moving these into the world, along with often with participants who have taken part, who then become speakers with me to different audiences, and writers with me of different kinds of things to move those into the world. We've done exhibits, we've done, like, you name it, we've done it. But I would love to keep hearing from all of you around ideas. Like we have a couple of grants for funding to do this project here, as well as to do other storytelling with autistic and folks with developmental disabilities here. So, and CAMH would be a partner on that. So then this group could mobilize, right? Like, but we're waiting on those
Can it,
funding
like, super quick, and
outcomes.
I'm sure Yona's going to come in and tie this up in about, was there a call to action at the end of each of those? Was there something for the viewer to do at the end of each of those videos? I forget. Was there something that said now? Because I know it's going to be different. You're going to use some
Oh,
different
like you
policy
want
change, but
me to, yeah, I see what you mean. So yes. So for each professional development workshop, for example, we would have steps to take. So yes, moving it into practice or moving it into research or whoever the audience is. Yes. Yeah. Like that's such a core piece that, yeah. 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 Can I just share the QR codes quickly if you want to learn more about these projects? And you can also sort of probably get them afterwards. But here were just sort of some conclusions that I would invite you to take a look at. But the QR code on the left is for the Tired of Spinning Plates website, with all of sort of what we did and what we did with what we did. And then my larger project, the Restoring Autism Project, which this is, you know, linked to through storytelling, is on the right there. And if you think about action you would like to take, please do keep me in mind, and I would love to hear from you. And I believe I'm sharing these slides after, so if you didn't get those QR codes, then you can get them once you get the slides.
Thanks so
Yeah.
much, Patty. And thanks everyone for joining. I mean, again, I think Patty is just down the 401. Not
I live in
and you're actually
Toronto.
in Toronto. I mean,
So
that's,
yeah,
you know,
I take the via out to Kingston,
yeah. So,
but I
so this
live
is
in
like what a resource, right? I mean, Patty's really become an expert in terms of supporting people to tell their stories. And it's very effective. It's a big part of what we do. It's very connected to, you know, you're hearing, we also do a lot of stuff around health care provider education. So I think it's thinking about, I was just thinking about how sometimes you want to have your story on the ready for where it matches a particular sort of policy agenda, educational moment, whatever. And I was thinking, like with these videos on caregiving, they fit a lot with what we see in the new caregiving report that just came out from the Canadian Center for Caregiving Excellence, but they have English accents, right? So that's why we
That's
need
right.
our own stories. And
We
I think
need our
we
own
have some of the
stories. Yep.
stories, like the restoring autism. There's lots of videos that are useful there. I
Yep.
think as we think about our autism agenda, not because you have a national autism agenda, there's all these steps and things that are happening. But I think
That's
we
right.
feel like some of the caregiving stories are a bit missing, then that's something I think for us to keep in mind. And then we kind of know, like, here's a video you could use in this way, almost like a, you know, like a toolkit of how to use videos effectively. And also what's kind of permitted and what's understood with it, because you want to create those toolkits with the people who've created the
Yeah,
content.
that's right. I love that idea. Yeah, I really, really love that. And I just saw, Yona, you suggested something else. So love this. This is where my energy is these days, as well as more stories. So you never know, like hopefully we'll get the funding and we can do some storytelling with
Yeah, and
this group. Like
maybe the
that's
other
the
thing is that,
plan.
you know, maybe, you know, while we're waiting, you know, maybe there's a few imperfect stories we can tell. Maybe there's some kind of pilot work we can think about supporting, because
Yeah,
it's just really important to keep this work going. So
yeah,
let's
yeah.
keep thinking about it in the work that we're doing, about how we can work with Patty, and let's keep the conversation going. It is 1 o'clock. So everybody, thank you. We do not have a speaker series next month, but we do have one. Oh, we do have one next month, Tiz. We don't. We're taking a month or two off, but we have one at the end of
Nice.
August as we get ready for the fall. On siblings, in fact. We have a siblings researcher coming from Australia,
Oh,
Patty. You're welcome
I
to
might hop
come.
into that. Yeah,
Yeah, totally. So
yeah.
have a good week, everyone. And don't forget Sunrise Challenge, baked goods, and many activities we're doing this week to support mental health and come together as a community. So thanks,
That's
everyone.
awesome. Thanks so much, everyone. It was such a pleasure to meet you all and be here today. Thanks, Yona, for the invite.
Yeah,
Yeah,
thank you.
take care. Hopefully, we'll talk again. Bye for now.